This is called the IT band stretch, and what you'll have the patient do, if we want to stretch the left hip, for example, we'll cross the right foot in front of it and lean to the side and make sure to really get the hip popping out so you feel the stretch along here in your IT band, and you'll hold it for 30 seconds 3 times. One thing you don't want the patient to do is to lean too far back or too far forward when doing it, otherwise it will start stretching different muscles and not get the IT band. If they need to adjust, they can lean forward slightly, but not too far forward. So this is just called the quad stretch, and there's 2 ways to do it. There's standing, where you just bring your foot up behind you, making sure to keep yourself from bending over like this, but just getting a deep stretch in the quad there. Or you can lay down on a table, and then same thing, just bring your leg up behind you like this and hold it for 30 seconds 3 times. All right, this is called the 90-90 hamstring stretch. So what you'll do is have the patient lay down on their back, and they'll have their hip at 90 degrees and their knee at 90 degrees. And they'll just hold the back of their thigh like this. If they can't quite reach it, you can give them a strap, and then they'll just straighten the leg as much as they can until they feel a stretch, hold it for 30 seconds, and then rest, and then they'll just do that again.
This stretch is called the standing adductor stretch. So you'll usually want them to be near a table or something so they can brace themselves, and they'll have a wide stance and kind of lean, keeping the affected leg straight till they feel a stretch on their inner thigh. And they'll hold that 3 times 30 seconds. Another variation of the stretch is to have them sit down. It's called the butterfly stretch, and they'll bend their knees and put them out and pull their feet towards them as close as they can and have a slight lean forward, stretching out again their inner thighs. This stretch is called the half kneeling hip flexor stretch. We will usually give the patients a foam to kneel on and place it on the ground, and they will kneel on the affected side. So say it's my left side, and just have them kneel, having their other leg up and lean forward so they feel a good stretch on the front of their thigh. Some issues with this, if they're not feeling it, is make sure that they're standing up tall and not leaning forward with their chest, and then have their pelvis tucked as well as they're standing up tall, and it's a slight lean forward, not a full body collapse over. And again, that's for 3 times 30 seconds. This machine is called the multi-hip. There are a couple ways we can adjust it for each direction. We'll do 4 directions on it, but you'll want to pull this little tab out and adjust it either direction, depending on which leg it is or which direction we're having them do. And if it makes that click, you know that it's in the right spot. You can adjust the weight by just pulling out the pin and selecting the level that you want them to be on. If they can't bump up a full level, we have a little half weight just hanging on the side that they can adjust it with. And the last thing, oh my gosh. The last thing that we can adjust is the height of the board, and you just do that by lifting up both sides and moving the whole up and down. It's really important to make sure that it's securely in there, so I like to give it a good stomp, or else the patient can drop completely, and we really don't want that to happen. And also adjust the height of this pad by just unscrewing it and sliding it up and down and screwing it back. All right, this first direction is called Flexion. So you'll want the pad to be in front of their knee and have them facing the side, gripping on using both hands. And they'll just be lifting up to a good 90 degrees. Back down, we'll do this 3 times 15. This next direction is called Abduction. So you want the pad to be on the outside of their leg, and you'll have them swing out to the side and back down, really focusing on keeping their toes pointed forward and not tilting their legs out. 3 seconds. This is an example of bad form is by letting your leg tilt out and come up like that. That's just working their flexors instead of their abductors. This direction is called extension. You want the pad to be high and them to lift their leg over top of it and have them just extend back, straightening their leg, and they'll do that 3 times 15. The last direction is adduction. You want the pad to be up again and put their leg on the outside of the pad and bring it across their body. Again, focusing on keeping toes pointed that way. 3 times 15.
This exercise is called hip IR and ER, and what you'll do is you'll get one of these bands and loop it around the patient's leg like this and hold it to the side and have them bring their leg in. 3 sets of 15. And then you'll also come around to the other side and hold it and have them rotate like this as well. When you're doing this one, when they're going out that direction, this is hip IR because the hip socket's rotating in, and it's kind of like going, if it were to continue, it would go like in a circle like that. And when you're doing this direction, this is hip ER because the hip joint's rotating out, and the same thing, just like kind of a circle rotating around. All right, this is called hamstring isometrics, and what you're gonna have the patient do is just hold, kind of a resist against the edge of a table or a ball or on the ground that they're digging like their heels in, and just holding it for 10 seconds 10 times. And there's short, mid, and long. It just kind of corresponds to the angle of their knee. So the closer this would be short, mid, and then long. All right, this is the ham curl machine, and the way you set it up is by bringing this knob out and lifting this up and then making sure it snaps into place, and then it's ready for the patient. And for the exercise, we'll have the weight down here and have the patient bring their affected leg up over this knob, and they'll just go down like this, and then keeping it nice and controlled, just go up and down 3 sets of 15.
Okay, this exercise is called monster walks. So you'll grab a clamshell band and slip it on your legs just above your knees, just like clamshells. And then you'll have the patient go around a table or a machine, something that they can make loops around, and have them come down to like a squatted athletic stance, and have them walk forward kind of at an angled, like diagonal steps. And then they will do side to side walking facing the same direction. And then again, backwards diagonal steps. And then repeat again, side steps on the other side. And they'll go 3 laps around the table. This exercise is called a mini squat. You can do it either on the total gym or do it standing. So I'm going to demonstrate both. So if you were to do it on the total gym, you have the patient lie down on the board and slide up till they have some slack with the rope. You don't actually have to unlatch them because they're not going to be going that deep. So you want them to squat to no more than 45 degrees and come back up just like that, and they'll do 3 sets of 15. If they were to do it standing, you'll have them again just squat about to 45 degrees, 3 sets of 15.
This exercise is called squatting iso load, and you'll have the patient come over here and hold onto this bar with both their hands, and they'll go down into a squat on both legs. They don't have to go super deep, and then they'll shift their weight onto the affected leg and hold it for 10 seconds 10 times.
This exercise is a wall sit, so you can do it either with or without a ball. So without the ball, you just have them come up against the wall, have their legs out a good point so their knees don't go over their toes, and they'll squat down to about a 90-degree angle and hold that 3 times 30 seconds. If they were to do it with a ball, they'll take an exercise ball, place it behind their back, enough room to let it slide down to be in their back, and again squat down to about 90 degrees, hold that 3 times 30 seconds.
This exercise is called long arc quads, or LAQs, as it'll be on the chart. And you'll have the patient just sitting on the edge of their table and then lifting their leg up for 3 sets of 15. And you can also add an ankle weight to make it a little bit harder.
All right, go.
All right, this exercise is called monster walks. So you'll grab, you'll grab a clam.
You glab it.
On the other side, and they'll go 3 laps around the table 3 times.
This exercise is squatting iso load. Okay. This is called the hip 90-90 hamstring stretch.
So just a hamstring stretch.
90-90 hamstring stretch.
You can also you can also